Hello all. Thank you so much for the opportunity to do this webinar on a vasectomy reversal. My name is Dr. Patel. I'll go a little bit over my background. So I'm currently an assistant professor within the section of urology at the University of Manitoba. I did my fellowship training in male infertility, microsurgery, and sexual medicine at the University of Miami. I did a 5-year urologic surgery residency at the University of Manitoba. Prior to that, I completed my medical school at the University of Calgary and my undergrad degree at the University of Ottawa. So to go over a vasectomy, so a vasectomy is the easiest, least invasive, and most cost-effective option to achieve contraception. However, some men wish to undergo a vasectomy reversal, and that can be for several reasons. So a change in female partner, a desire to have more children, wish to have children in the first place, as some men elect to have a vasectomy without having any prior children at all. Post-vasectomy pain. Although post-vasectomy pain is not very common, a vasectomy reversal can be a very effective treatment option for this condition. A failed prior vasectomy reversal. There are situations where a vasectomy reversal may ultimately not be successful, and that could be because of the formation of scar tissue, and a redo vasectomy reversal may be indicated in those situations. So what are options for fertility after having a vasectomy? So a vasectomy reversal, alternatively, sperm extraction and proceeding with IVF. So a very common question I get from couples is, which one should I go with? And when we think about the partner, as well as the time since vasectomy, and we look at prior published studies, if a vasectomy was less than 10 years ago and the female is less than 40, a vasectomy reversal tends to be the most cost-effective option. And we'll discuss why time since vasectomy is so important. So this comes into the considerations that I take when I see a couple that are looking for fertility options after having a vasectomy. So looking specifically at the male, I look at prior fertility. So do they have any prior children? Have they had any prior pregnancies? The other aspect that I take into consideration is, what was the time since vasectomy? And the reason why this is so important is that if a vasectomy was done a long time ago, you may ultimately develop more blockages along the tract, and that may mean you may have to do a more complex reconstruction at the time of the procedure. And that is called a vasoepididymostomy. So what that is you're connecting the vas deferens, so the tube that delivers the sperm, to the epididymis, which is closer to the testicle. And those tubes are exceedingly small. And so because of that, you can develop scar tissue and it may drop your success. And that is why it is so paramount for when a person is performing a vasectomy reversal to look under a microscope to see whether there's sperm present or not, as that really tells you which procedure to do. And I'll go into that in a little bit of detail as well. Other aspects that I take into consideration is just the general health of the patient. Have they had any prior surgeries? Do they take medications? Just to get a sense of what their overall health and well-being is like. When we think about medications, there are certain medications like testosterone replacement therapy that can actually drop the sperm count. So those are medications that I really want to elicit from a detailed history to make sure that there is nothing that could prevent this surgery from being the most successful as it can be. Now, when we consider the female factor, it's very important to understand the partner's previous fertility. Does she have regular periods? Has she had children? Has she had any prior pregnancies? As ultimately that can impact the success rate as well. The other aspect that needs to be taken into consideration is also female age. As women get older, reproductive potential tends to decrease. So it is important to understand how old the female is and whether that could be a potential factor that may impede the success of the procedure. So how is a vasectomy reversal performed? So typically it takes 2 to 3 hours, and it's most commonly performed under general anesthesia. And the reason for that is because you want the patient to be as still as possible, because you're using an operating microscope to connect these very tiny tubes together. And people often ask me, well, a vasectomy only took 15 minutes. Why is the reversal so long? And the reason for that is because these tubes are so small, in the ballpark of just 1 to 2 millimeters. And you're trying to connect them with very fine sutures that are even thinner than your hair. So, and because of that, it takes you extensive time to make sure that you're performing this procedure properly, and using an operating microscope is a must when performing a vasectomy reversal. The procedure is done as a day surgery, so you go home after. You do have the option to free sperm at the time of surgery, which could serve as a backup if you ultimately may elect to undergo IVF at a later date, if for some reason the vasectomy reversal is not successful. So there are ultimately two operations that can be done. And so one could be that vasovasostomy, where essentially you're reconnecting the tubes that were cut at the time of the vasectomy. The other option is proceeding with the vasoepididymostomy, which is a very complex microsurgical procedure where you are connecting the vas to the epididymis. This does not change anything with respect to the procedure itself. It'll still be done in that 2 to 3 hour time frame. Sometimes it may take a little bit longer, and overall healing is essentially the same, but it can take sperm longer to return in the ejaculate, and the success rates can go down. And as I mentioned before, the reason for that is because when you perform a vasoepididymostomy, you're connecting a very small tube already, the vas deferens, to an even smaller tube. And so you may ultimately have a higher chance of scar tissue forming, and the chance of success for that procedure can range from 50 to 60%, whereas if you are just reconnecting the tubes, the chance of success is generally over 95%. So when do you know if you're performing one procedure or the other? That is determined at the time of surgery. So although the time since vasectomy is an important variable, the surgeon must look for sperm at the time of surgery to see if the tube is still flowing. If the tubes are still open, if sperm is still flowing through the tube, then we tend to perform the more successful procedure, the vasovasostomy. If there is no sperm, that means secondary blockages have developed and you need to do that more complex procedure. That is also why if a vasectomy was done less than 10 years ago, you are significantly more likely to perform the vasovasostomy, but it is paramount to look for sperm at the time of surgery. So what to expect after a reversal? As I mentioned, it takes about 2 to 3 hours to do the reversal. It is day surgery. You go home the same day. I typically perform this with a small, just one small incision where I'm able to perform both the vasovasostomy or vasoepididymostomy if necessary. I recommend the patient for the next 24 hours to take it easy. You tend to have very minimal discomfort, and oftentimes I will prescribe a little bit of stronger medication, but extra strength Tylenol and anti-inflammatories, if there are no contraindications, take that medication should be adequate. 2 weeks of no heavy lifting or ejaculating to allow the area to heal. You can ultimately start trying to conceive after 2 weeks. I've had a number of patients who've actually were able to conceive prior to even undergoing the first semen test, which is typically performed 2 to 3 months post-surgery. And I like my patients to perform the semen analysis every 2 to 3 months until we start seeing sperm back in the ejaculate. I also like to follow up my patients to make sure that ultimately we are having a good outcome, which to me is not just sperm coming back, but is actually being able to have a pregnancy and taking a baby home at the end of the day. So ultimately, how do you select your surgeon? It's very important to have somebody who has fellowship training in male infertility and microsurgery. And the reason for that is because subspecialists who've done this extensive training perform microsurgery routinely for a number of procedures. As such, we are very comfortable under the microscope, and we make sure that we're performing this procedure to achieve the highest level of success. Individuals who perform vasectomy reversals routinely. As I mentioned before, the vasoepididymostomy is not a common procedure, and as such, you really want somebody who knows how to do this procedure and who knows how to do it effectively, and someone who looks for sperm at the time of surgery so they can decide which procedure to do to make sure that we are achieving the highest level of success for you and your partner. So again, evaluates for the presence of sperm at the surgery. As I mentioned before, if there is no sperm present in the tube, you may need that more complex bypass surgery. And as such, the only way to know that is to look for sperm. And someone who performs both the vasovasostomy and vasoepididymostomy. So thank you so much for the opportunity to do this webinar. You can reach me on my website at manitobafertility.com. Alternatively, my email's here as well. If you have any questions about this webinar or any questions that were not answered, or if there's something else that was part of this talk and you've had those questions, I'm happy to assist with that as well. Thank you so much.